Hey everyone, and welcome back for another deep dive. Today, we are taking a close look at something I think we can all relate to: musculoskeletal injuries.
Uh-huh.
I mean, think about it. Who hasn't twisted an ankle playing a sport or felt that nagging back pain from sitting too long? We have some fascinating nursing school notes here, CNUR 204 to be exact.
Oh,
And
interesting.
we're going to really unpack these notes, really explore these injuries in more detail, understand why they happen, how to prevent them, and what to watch out for.
Yeah.
What stands out to you as we go through these notes? What, like, aha moments do you have?
Well, I think it's interesting. Most of us have a general idea about strains, sprains, but these notes really kind of get into the nitty-gritty of what's going on.
Yeah.
And
Yeah,
I think there's a lot to learn.
for sure. Well, and I know bones are important, duh, but I was blown away by how many ways they can actually break.
Oh, yeah.
And then, there's all the things that can go wrong, even if you do everything right. Like, it's
Exactly.
wild.
You can do everything by the book and still have complications.
Yeah.
It really underscores the importance of understanding these injuries in the first place.
Okay, so let's get into these notes. What's the first thing that, jumps out at you?
Well, before we get into the injuries themselves, we kind of need a quick bone basics refresher, right? They're not just static structures. They're dynamic living tissues that are constantly, adapting
Yeah.
and they have multiple jobs. So, it's important to understand that foundation.
That's so true. I always forget they're not just like scaffolding for our bodies.
Right.
They protect our organs, store minerals, and even produce blood cells.
Exactly. They're constantly being remodeled and rebuilt thanks to this amazing team of cells, osteoclasts, osteoblasts, and osteocytes. It's like a construction crew working around the clock.
I love that analogy.
Yeah.
So the osteoclasts are the demolition crew, breaking down old bone, and the osteoblasts are the builders, laying down new bone.
Precisely. And then you have those osteocytes, which are kind of like supervisors, making sure everything's running smoothly.
That's amazing. And it all happens under this protective membrane, the periosteum, that's like packed with nerves. No wonder bone injuries hurt so much.
It's a good reminder that even though we can't see it, there's so much going on beneath the surface.
Yeah.
And that brings us to the injuries themselves.
Okay, let's talk soft tissue injuries. I think most of us have experienced a strain or a sprain at some point.
Right. These are the injuries we're most likely to encounter in our everyday lives. So a strain, right, it's an overstretching or tear of a muscle or tendon, whereas a sprain involves the ligaments that connect those bones at a joint.
Yeah.
So there's a subtle but important difference there.
Oh, for sure. And those are both graded on a scale of severity.
Exactly.
Right,
Yeah.
like mild to severe.
Yeah, from mild to severe. So mild strain, it might feel like a slight pull, right?
Uh-huh.
Whereas a severe strain can involve a complete tear of that muscle. Same with sprains, A minor sprain might involve some stretching of the ligament, whereas a severe sprain could mean, a complete tear.
Now, here's something that always surprises me. Even a minor sprain or strain can take weeks to heal properly.
Yeah, it's true.
I always think, I'll be back on my feet in a few days. But, these injuries need time to recover.
They do.
And that's where RICE comes in. Rest, ice, compression, elevation. It's not just a catchy acronym, right?
All right.
It's like a tried and true method for managing those injuries and, minimizing that swelling and the pain.
Absolutely.
I've used RICE countless times, but I never really understood why it works.
Sure.
Can you break it down?
Yeah. So rest, right? Rest helps prevent further damage to that injured tissue.
Okay.
Ice reduces inflammation, helps numb the pain. Compression helps limit that swelling. And elevation, working against gravity, further reduces blood flow to the area. And it's amazing how those simple steps can really make a difference.
It's like giving your body that best possible environment to heal itself, I guess.
Exactly.
But sometimes those soft tissue injuries can be more serious, right? The notes mention dislocations and subluxations, and those just sound intense.
They can be. A dislocation is a complete separation of those joint surfaces.
Yeah.
Think about like a finger that's bent at an unnatural angle.
Yeah.
A subluxation is a partial dislocation, so the bones are still partially in contact.
So with the dislocation, the bones are completely out of alignment, while a subluxation, they're just kind of partially out of whack.
Yeah, that's a great way to put it. And dislocations, they can be real emergencies.
Why is that? I mean, they sound painful, but
Right.
what makes them so serious?
Well, because there's that risk of damage to blood vessels and nerves. And if the blood supply is cut off to the bone, it can lead to a vascular necrosis, essentially bone death.
Wow, that sounds scary. So it's not just about popping the bone back in place.
No,
Like there's a lot more to it.
there's a lot more to it.
Oh.
And then there's compartment syndrome, which is another serious complication that
Right.
can happen with any injury that causes swelling within a muscle compartment.
Okay, break that down for me. What exactly is a compartment syndrome?
Okay, so imagine a muscle group encased in this, like, tough, inelastic fascia, almost like a sausage casing, right?
Okay.
So when there's swelling within that compartment, that pressure builds up, and it has nowhere to go.
So it's like a pressure cooker situation.
Exactly. And that pressure can then compress blood vessels and nerves, which cuts off circulation and causes severe pain.
Oh, that sounds incredibly painful. And if it's not treated quickly, it can lead to permanent damage.
Absolutely.
Oh, wow. So we've talked about strains, sprains, dislocations, and compartment syndrome. What other soft tissue injuries do these notes cover?
Well, let's talk about the ones that can really sneak up on you, those repetitive strain injuries
Yeah.
that often plague people with desk jobs, musicians, athletes,
Yeah.
anyone who does, repetitive tasks.
Oh, like carpal tunnel, that pain in the wrist and hand.
Exactly. So that's caused by compression of the median nerve, which runs through a narrow tunnel in your wrist. And it's often brought on by repetitive hand movements, like typing or using a mouse.
Oh, that makes sense.
Yeah?
And then there's bursitis, right? Isn't that inflammation of those fluid-filled sacs that cushion the joints?
You're right. And that can be incredibly painful. And it often affects the shoulder, the elbow, the knee. And it's often caused by overuse, prolonged pressure, or even a direct blow to that area.
So if I'm kneeling for a long time, gardening, I could end up with bursitis in my knee.
It's definitely a possibility. And then, of course, there's tendonitis, which is the inflammation of a tendon.
Ah, like tennis elbow.
Yeah, tennis elbow is a classic example.
I've heard that one a lot.
It can affect other tendons as well, like the Achilles tendon in your ankle.
So the key takeaway here is that repetitive movements can really take a toll
Yes.
on our bodies.
Huh?
And it's not just athletes who are at risk, it's anyone
Right, it's anyone.
who does those tasks over and over,
Exactly.
day in and day out.
Yep. And that brings us to two specific areas that are, particularly prone to injury. The rotator cuff in the shoulder and the meniscus in the knee. Okay. Let's start with the rotator cuff. I know it's something that baseball pitchers injure often.
Yeah.
But what exactly is it?
So the rotator cuff is this group of muscles and tendons that surround the shoulder joint, right? It's providing stability and allowing a wide range of motion. It's involved in almost every shoulder movement, from like reaching overhead to throwing a ball.
So it's a pretty important structure. What kinds of injuries can happen to it?
Well, the tendons can become inflamed or torn either from a sudden impact, like a fall or a direct blow,
Yeah.
or from repetitive overhead motions, like throwing a baseball or even painting a ceiling.
And those injuries can be incredibly painful, right? Like really debilitating.
They can be. And sometimes those rotator cuff tears require surgery
Oh, wow.
to repair the damage.
Now let's move on to the knee and talk about the meniscus.
Okay.
The meniscus, that's the cartilage in the knee, right?
Right.
You got it.
Yeah.
The meniscus is this C-shaped piece of cartilage
Okay.
that acts as a shock absorber between the femur, your thigh bone, and the tibia, your shin bone.
Got it. So it's basically a cushion in the knee joint.
Exactly. And it's vulnerable to tears, especially from twisting or pivoting motions, which are often seen in sports.
I can see how that would happen, sudden change in direction, a wrong step, and bam, meniscus tear.
Exactly. And those tears can be quite painful and can really limit mobility.
So what's the treatment for rotator cuff and meniscus injuries?
Well, it depends on the severity of the injury.
Okay.
Right. For minor tears, conservative treatment like rest, ice, compression, physical therapy might be enough. But for more severe tears, surgery might be necessary to repair the damage.
It sounds like physiotherapy is like a key part of the recovery process.
Absolutely. Physical therapy helps to strengthen the muscles around the joint, improve range of motion, and reduce pain.
Okay, so we've covered a lot of ground with those soft tissue injuries, ready to move on to the bone-crunching stuff. Let's do it. Fractures are a whole other world of complexity.
Yeah.
And they're surprisingly common.
I have to admit, I'm a little intimidated by fractures.
Uh-huh.
They just seem so much more serious
They can be.
than, a sprain or a strain.
Especially if they're not managed properly.
Right.
But before we kind of dive into the nitty-gritty, let's take a step back and just appreciate, the incredible strength and resilience of our bones.
It's a good point. We often take our bones for granted until something goes wrong.
Exactly. So let's start with the basics. A fracture is simply a break in the bone.
Mm-hmm.
But there are so many different types of fractures, each with its own unique characteristics and, treatment considerations.
Okay, I'm ready to learn about all the ways a bone can break. Where do we begin?
Let's start with the most basic distinction, simple versus compound fractures.
Okay, I've heard those terms before, but I'm not sure I fully understand the difference. So a simple fracture, also known as a closed fracture, is a break where the bone doesn't pierce the skin. It might be a hairline crack or a complete break, but the skin remains intact.
So it's all internal damage.
Exactly. A compound fracture, on the other hand, is an open fracture, meaning the bone protrudes through the skin.
Ouch, that sounds much more serious.
It is. Compound fractures are much more prone to infection because there's that direct pathway for bacteria to enter the body.
That makes sense. So simple versus compound is all about whether the skin's broken or not.
Right.
What other types of fractures are there?
Well, there are comminuted fractures, where the bone kind of shatters into multiple pieces.
Wow, that's like a jigsaw puzzle gone wrong.
It kind of is. And then there are green stick fractures, which are more common in children because their bones are softer and more flexible. So instead of breaking completely, the bone bends and cracks like a green twig.
Oh, that's a good visual. And I imagine those are less serious than a complete break.
They can be, but they still need to be treated properly to ensure they heal correctly.
Okay, what else?
Well, you have transverse fractures, which go straight across the bone.
Okay.
Spiral fractures, which happen with a twisting force. Oblique fractures, which are those angled breaks.
Got it.
You also have impacted fractures, where the broken ends are jammed together, and stress fractures, which are tiny cracks that develop from repetitive stress, often seen in athletes.
Wow, that's a lot to take in.
It is.
It's amazing how many different ways a bone can break.
It really is.
And all of these different types of fractures have implications for treatment and recovery, I'm assuming.
Absolutely.
So how do doctors decide how to treat a fracture?
Well, the first step is to determine the type and severity of the fracture, right? And they use imaging techniques like X-rays or CT scans.
Yeah.
They also consider the location of the fracture and whether it's stable or unstable.
Okay, stable versus unstable. That sounds important. What's the difference?
A stable fracture is one that stays aligned and is unlikely to move out of place.
Okay.
These fractures often heal well with conservative treatment, like casting or splinting. An unstable fracture, on the other hand, is one that's displaced or has a tendency to move out of alignment.
Right.
These often require surgery to realign the bones and hold them in place while they heal.
So stable fractures are kind of the set it and forget it kind.
Yeah.
While unstable need a bit more intervention.
Exactly.
Makes sense. Now, what are the most common causes of fractures?
You might be surprised to learn that falls are the most common cause of fractures.
Really?
Especially in older adults.
I would have thought car accidents or sports injuries would be higher up on the list.
Well, falls are a major public health issue, especially for older adults who are more prone to falls and have weaker bones.
So it's not just the impact of the fall itself, it's also about the increased fragility of bones as we age.
Exactly, and that's why fall prevention is so important, especially for older adults.
Speaking of age, does age play a role in how fractures heal? Do younger people heal faster?
It does. Children tend to heal much faster than adults because their bones are still growing and have a richer blood supply.
It's like a superpower that we lose as we get older.
You could say that. But even in adults, bones have this amazing ability to heal themselves. And it's a fascinating process.
Okay. I'm ready for a crash course in Bone Healing 101. What actually happens when a bone breaks?
Well, it's not just about the bone itself. It's this complex process that involves multiple tissues and cells working together in this beautifully orchestrated sequence.
So it's like a symphony of healing happening inside the body.
I love that analogy. It really is like a symphony, with each instrument playing its part at just the right time.
I like that.
So the first stage is hematoma formation. This is where a blood clot forms at the fracture site.
Okay.
It's kind of like the percussion section, right? Setting the beat for the healing process.
So the blood clot is like the foundation of the healing process.
Exactly. It provides a scaffold for the next stage, which is granulation tissue formation. So this is where soft, fibrous tissue starts to bridge the gap between the broken ends of the bone. Think of it like the strings section, laying down the melody of healing.
Okay, so we've got the percussion and the strings. What comes next?
Next comes callus formation. So that soft granulation tissue gradually hardens into this bony callus. Think of it like the brass section, adding strength and structure to that healing bone.
So it's like the bone is building its own internal cast.
That's a great way to think about it. And as that callus hardens further, we move into ossification, where the soft callus is replaced with new bone tissue. This is like the woodwind section, bringing in the harmony and refinement.
Okay, so we've got percussion, strings, brass, and woodwinds. We're building quite the orchestra here.
We are.
What are the final stages?
The final stages are consolidation and remodeling. So consolidation is like the full orchestra playing together, creating this, unified and strong sound. This is where the new bone tissue becomes dense and strong, bridging the gap between those broken ends. And finally, remodeling is like the conductor, refining and perfecting the symphony. This stage can take months or even years as the bone continues to reshape and remodel itself, eventually returning to its original form.
Whoa, that is an amazing process.
It is.
It's like the body's this master architect rebuilding itself from the inside out. But even with this, incredible healing power, complications can arise, right?
Unfortunately, yes. Sometimes that healing process doesn't go as smoothly as we'd like.
Right.
And that's when we see complications like delayed union, non-union, and malunion.
Okay, break those down for me. What do those terms mean?
Okay, so delayed union is just what it sounds like. The bone's taking longer than expected to heal.
So it's like the orchestra is playing a bit slower than usual.
Exactly. And it can be caused by a variety of factors like poor blood supply, infection, or inadequate immobilization. Non-union, on the other hand, is when the bone fails to heal altogether.
Oh no, that's terrible.
It's like the orchestra just stopped playing, right?
Right.
Leaving an unfinished symphony.
Oh.
And that can be due to a number of factors, including infection, poor blood supply, excessive movement, or even smoking, which can interfere with bone healing.
Wow. And malunion.
So malunion is when the bone heals, but in an abnormal position. It's like a crooked symphony.
Oh.
And it can be caused by inadequate immobilization or a fracture that wasn't properly aligned.
So it's like the conductor let the orchestra play out of tune.
You got it. And it can lead to long-term problems like pain, stiffness, and limited mobility.
Oh no. It sounds like preventing these complications is all about giving the bone the best possible chance to heal.
You're absolutely right.
Right.
Proper immobilization, controlling infection, maintaining good nutrition, and avoiding smoking are all crucial factors in promoting optimal bone healing.
Okay, so we've covered a lot of ground with fractures, the different types, the healing process, and the potential complications. What stands out to you most from this information?
Well, what's fascinating to me is just the sheer complexity of that healing process.
Yep.
And that amazing ability of the body to repair itself.
Yeah.
It's a reminder that even when things go wrong, there's this incredible force at work.
Yeah.
Trying to put things right.
I completely agree. And it makes me appreciate the role of healthcare professionals in supporting
Absolutely.
and guiding that healing process. But before we dive into that, let's take a break and come back refreshed for part 2 of our deep dive.
Sounds good.
We'll explore the specific challenges of hip fractures,
Right.
the crucial role of nursing care, and the importance of pain management in that whole recovery process.
I'm looking forward to it.
See you soon.
See you then. Welcome back to our deep dive into the world of musculoskeletal injuries.
It's amazing how much we've already uncovered just in that first part, about bones and how they heal, all those different types of fractures.
Yeah, it's fascinating, isn't it?
It is. But I'm ready to get even more specific. What really stood out to me in these notes was that section on hip fractures. They seem especially serious, especially for older adults.
Oh, absolutely. You're right to be concerned. Hip fractures are a huge concern, particularly in that older population.
Yeah.
They often result from falls, and the consequences can be, really significant.
Yeah, the notes mention that they can impact a person's ability to walk, live independently.
Yeah.
It's kind of heartbreaking.
It is. It can really affect their quality of life, and that recovery process can be long and challenging. But, before we even get into the treatment and recovery, how can we even recognize a hip fracture in the first place?
Yeah.
Like, what should we be looking for?
That's a great question. I'm sure, a lot of us have older relatives.
Right.
And knowing those signs could be so crucial.
Absolutely. One of the most obvious signs is severe pain, in the hip or groin area. And this pain is often described as just relentless, doesn't get better with rest.
So if someone's complaining of hip pain after a fall, that's a major red flag.
Yes, especially if it's intense and doesn't subside. Another telltale sign is difficulty moving or bearing weight on that affected leg. They might not be able to stand up or walk without significant pain.
Yeah, I imagine that would make even simple tasks like getting out of bed or going to the bathroom, nearly impossible.
Exactly, you're right.
Yeah.
And you might also notice that the injured leg appears shorter than the other leg, or that it's rotated outward.
So if you see any combination of these signs, especially after a fall, it's crucial to seek medical attention right away.
Absolutely. Couldn't agree more. Early diagnosis and treatment are key.
Okay, so let's say someone does have a hip fracture. What happens next? What are the treatment options?
Well, in most cases, surgery is recommended to repair that fracture and allow for, early mobilization
Early mobilization. Why is that so important?
because it helps prevent complications, things like pneumonia, blood clots, pressure ulcers, all those things that are risks for people who are immobile, for long periods.
So it's not just about fixing the bone, it's about getting people moving again as soon as possible.
Exactly. There are a couple of different surgical approaches depending on the type and severity of that fracture. One option is what we call OR-RIF, open reduction and internal fixation.
That sounds intense. What does that involve?
Basically, the surgeon makes an incision to access the fracture site, right? They align those broken bone fragments and then secure them in place using, metal plates, screws, or rods.
So it's like putting the pieces of a broken vase back together and holding them in place with like super strong glue.
That's a great analogy. And the other common surgical option is a hip replacement, either partial or total.
I've heard of hip replacements, but I'm not sure I understand the difference between partial and total.
So in a partial hip replacement, only the head of the femur, that ball part of the ball and socket joint, is replaced with a prosthesis.
Yeah.
In a total hip replacement, both the ball and the socket, which is part of the pelvis, are replaced.
So a total hip replacement is obviously a much more extensive procedure.
Yes, it is. And the choice between those two really depends on a lot of factors. The patient's age, their overall health, the extent of damage to that hip joint.
It sounds like hip surgery is a major undertaking.
It is.
What's the recovery process like?
It can be quite challenging, but with the right care and rehabilitation, most people can regain their mobility and their independence. And nurses play a really crucial role in this process. They're providing care before, during, and after the surgery.
Yeah, I can imagine they're the ones that are right there with the patient every step of the way.
Exactly. Before surgery, nurses educate the patients about what to expect. They answer their questions, and they help them prepare, physically and emotionally.
Right.
During surgery, they're assisting the surgical team, monitoring the patient's vital signs, and then, of course, after surgery, that's when that post-operative care really kicks in.
And what does that involve?
It's all about managing pain, preventing complications, and helping those patients regain their strength and mobility. Nurses are responsible for monitoring vital signs, administering medications, assisting with wound care, teaching patients how to move safely, and use, assistive devices.
So it's a lot more than just checking bandages and making sure they're comfortable.
Oh, absolutely. Nurses are also educating those patients about potential complications, warning signs to watch out for, and they also help the patients and their families understand that recovery process and what to expect along the way.
It sounds like they're not just caregivers, they're like educators and advocates for their patients.
Exactly. They're empowering those patients to take an active role in their recovery and help them kind of navigate those challenges ahead.
And I'm starting to see just how vital nurses are, to this whole process, from the initial assessment all the way to discharge planning.
They are. And one area where their expertise is so crucial is pain management. As you can imagine, hip fractures are incredibly painful.
Yeah, I can only imagine. I remember like spraining my ankle, and that was bad enough.
Right.
I can't fathom the pain of a broken hip.
It's not something anyone wants to experience, but the good news is that we have so many effective pain management strategies available.
Like what? What are some of the tools in a nurse's pain management toolkit?
Well, medications are often that first line of defense, right?
Mm-hmm.
We use a variety of pain relievers, including opioids, NSAIDs, nerve blocks.
I know opioids are powerful painkillers, but I've also heard about the risks, addiction, side effects. How do nurses kind of balance the need for pain relief with those concerns?
It's a delicate balance, for sure. Yeah. And it requires careful assessment, monitoring, and really open communication with the patient. We start with the lowest effective dose and adjust as needed. And we also really educate patients about the potential side effects and risks of opioid use.
So it's not just about prescribing medication. It's about educating and empowering patients to make, informed decisions.
Precisely. And we don't rely solely on medications, right? We also use non-pharmacological approaches like ice, heat, elevation, positioning, all those things to help manage pain as well.
I've used ice and heat for muscle soreness, but how do those techniques work with bone pain?
Well, while they don't directly target the bone itself, they can help reduce inflammation and swelling in those surrounding tissues. which can then alleviate some of that pain.
So it's about kind of addressing the pain from multiple angles.
Exactly. And as the patient heals, we encourage gentle movement and exercise, as tolerated. This helps improve circulation, reduce stiffness, strengthen the muscles, which can also help reduce pain.
So it sounds like pain management is really this holistic process that involves, both physical and emotional support.
You hit the nail on the head. We also provide emotional support, reassurance, education, help them cope with the challenges of pain and immobility. And sometimes we might even involve, a psychologist or a pain specialist if needed.
It's a team effort, really, everyone working together to help that patient heal and regain their quality of life.
Absolutely. Speaking of teamwork, let's shift gears a bit and talk about preventing complications after a musculoskeletal injury.
Okay.
Because as we've discussed, there are a number of potential complications, right? Things like infection, compartment syndrome, DVT, and nurses play a huge role in preventing these from developing in the first place.
Okay, let's start with infection. I know open fractures are especially vulnerable to infection because the bone is exposed.
Right.
What steps are taken to minimize that risk?
Well, meticulous wound care is so important.
Yeah.
This involves, cleaning the wound thoroughly with soap and water or a prescribed antiseptic solution, applying antibiotic ointment, and then covering it with a sterile dressing.
So it's all about keeping that wound clean and protected.
Exactly.
Yeah.
We also educate the patients and their families about the signs and symptoms of infection. Things like redness, swelling, warmth, pain, drainage, fever. We emphasize, seeking medical attention right away if they notice any of these signs.
So it's not just about what happens in the hospital. It's about empowering patients to be, proactive about their health once they go home.
Exactly. And in many cases, prophylactic antibiotics are prescribed, for those open fractures and surgical procedures to further reduce that risk.
That makes sense. Now let's revisit compartment syndrome. We touched on it earlier.
Yeah.
But it's such a serious complication that it's, worth emphasizing.
It is. It's a condition that can develop when there's increased pressure within a muscle compartment, usually in the arms or legs.
Right.
And that pressure can restrict blood flow, which leads to muscle and nerve damage if it's not treated quickly.
Yeah, and I remember you mentioned the 5 Ps: pain, pallor, pulselessness, paresthesia, and paralysis. But you said pain is often that earliest and most reliable indicator.
Absolutely. And that pain is typically severe, unrelenting, and kind of out of proportion to the injury. So if a patient is complaining of, severe pain, especially if it's not relieved by medication or if it's accompanied by any of those other Ps, we need to act fast.
So it's a situation where time is of the essence.
Yeah.
What's the course of action in that scenario?
We immediately notify the physician and prepare for a fasciotomy, which is a surgical procedure to relieve that pressure within that compartment.
So it's a surgical emergency.
Yes, it is. The fascia, that tough tissue surrounding the muscle, is cut open to allow that muscle to swell and relieve the pressure. It can be limb-saving.
Wow, that's intense. Okay, let's move on to DVT, another potential complication that we've discussed. Can you remind us what DVT is and why it's so concerning?
Sure. DVT stands for deep vein thrombosis. It's a blood clot that forms in a deep vein, usually in the legs. And this is a concern after a musculoskeletal injury because, immobility increases that risk of clot formation.
So it's like a traffic jam in the bloodstream.
That's a great analogy.
Yeah.
And the real danger is that clot can break free and travel to the lungs, causing a pulmonary embolism, which can be life-threatening.
That sounds terrifying. How can we prevent that from happening?
Well, early mobilization is one of the most effective strategies. Getting patients up and moving as soon as possible helps improve that blood flow and reduce the risk of clot formation.
Yeah, that makes sense. What else can be done?
We also use compression stockings, which apply gentle pressure to the legs, helping improve blood flow and prevent blood from pooling in the veins.
I've seen those in the hospital. They look like really tight socks.
They are, and in some cases, particularly for patients who are at high risk of DVT, anticoagulant medications or blood thinners might be prescribed to further reduce that risk.
It's kind of a multi-pronged approach. Early mobilization, compression stockings, and sometimes medication.
Exactly. By taking these steps, we can significantly reduce the risk of DVT and pulmonary embolism.
This is all such valuable information,
It is.
It makes me appreciate just how complex musculoskeletal care can be and how crucial nurses are in preventing those complications and ensuring good outcomes for their patients.
I couldn't agree more. They're truly the unsung heroes of healthcare.
Well said. As we wrap up this part of our deep dive, what's been the most I don't know, surprising or insightful takeaway for you so far?
Well, for me, it's the realization that, even though we often think of bones as these static structures, they're actually dynamic, constantly changing.
Right.
And the healing process is remarkable.
Mm.
It's testament to the body's ability to repair itself.
I completely agree. And it makes me wonder, how does all of this knowledge about musculoskeletal injuries translate into real-world situations? How can we apply what we've learned, to our own lives and the lives of our loved ones?
That's a great question, and it's one we're going to explore in the final part of our deep dive. We'll look at those broader implications of musculoskeletal health, dive into prevention strategies, and consider the impact of these injuries on overall well-being.
I'm looking forward to it.
Stay tuned.
We've really been on quite the journey through the world of musculoskeletal injuries, haven't we?
We have, from bone healing to hip fractures to the role of nurses in preventing complications, it's been an incredible exploration.
It really has. And look, it's amazing how much we take our musculoskeletal system for granted until something goes wrong, right?
Mm.
But I'm curious, how can we apply all this knowledge to our everyday lives?
That's a great question. And I think that's something we should all be thinking about.
Yeah.
Prevention is really key when it comes to musculoskeletal health.
Okay, so let's talk prevention. What are some practical steps we can take, to protect our bones and joints and minimize our risk of injuries?
Well, a healthy lifestyle is really the foundation.
Mm.
Eating a balanced diet rich in calcium and vitamin D.
Oh, yeah. I've always heard that, milk is good for strong bones.
Right.
Is that because of the calcium?
Exactly.
Yeah.
Calcium is a key building block for bones.
Yeah.
And vitamin D helps your body absorb that calcium efficiently.
Mm.
So it's a dynamic duo. They work together.
They do. And don't underestimate the power of regular weight-bearing exercise, right?
Oh, absolutely.
Things like walking, running, dancing, strength training.
Yeah.
Those all help build bone density.
Right.
Strengthen muscles. Absolutely.
So it's not just about building muscles, it's about building stronger bones, too.
You got it. And maintaining a healthy weight is huge. Excess weight puts extra stress on your joints, increasing your risk of injuries and conditions like osteoarthritis.
It's like carrying around extra baggage all the time.
It is.
Your joints are bound to complain eventually.
They are. And then, good posture and proper body mechanics. These simple habits can really go a long way in preventing back pain and other musculoskeletal problems.
I'm so guilty of slouching at my desk sometimes.
Oh, me too.
What are some tips for maintaining, good posture?
Just be mindful of your alignment,
Yeah.
Sit or stand tall with your shoulders relaxed, your back straight.
Right.
When lifting heavy objects, bend at your knees, not your waist, and keep that object close to your body. It's all about distributing that weight evenly and avoiding strain.
Those are great tips. I'm definitely going to try to be more conscious of my posture from now on. What else can we do, to protect our musculoskeletal health? It's important to listen to your body. If you're experiencing pain, don't ignore it. Rest, ice, over-the-counter pain relievers can often help with those minor aches and pains.
So it's okay to take a break.
Oh, yeah.
When your body's telling you to.
Absolutely. Pushing through pain can often make things worse.
Right.
But if the pain persists or if it worsens, it's important to see a doctor to get a proper diagnosis and treatment plan.
So it's about finding that balance between, self-care and then knowing when to seek professional help.
Exactly. Early intervention is key, right? It can really make a difference.
It can. We've talked a lot about individual responsibility.
Yeah.
But what about workplace safety?
Right.
And ergonomics, like the way we set up our workspaces?
That's crucial, especially considering that so many injuries are work-related. Employers have a responsibility to provide a safe work environment, right?
Yeah.
And to train their employees on proper lifting techniques, using the right equipment, taking breaks to avoid those repetitive strain injuries.
So it's a shared responsibility between the employers and the employees?
Absolutely. It takes both sides.
And what about older adults? We've talked about how they're at increased risk for, falls and fractures. Are there specific prevention strategies that are particularly important for them?
Yes, absolutely. Fall prevention is paramount for older adults. This might involve making some home modifications, removing tripping hazards, improving lighting, installing grab bars in the bathroom.
Yeah, so it's about making that home environment as safe as possible.
Exactly. And it's also important to address underlying medical conditions that can increase the risk of falls, right? Things like vision problems, balance issues, and medication side effects.
Right, so it's kind of a multifaceted approach that involves both, those environmental modifications and then addressing those health issues.
It is. And we can't forget about staying active and engaged as we age, right? Regular exercise, social interaction, mental stimulation, those all contribute to overall health and well-being.
So it's like a recipe for healthy aging, a little bit of physical activity, a dash of social connection, a sprinkle of mental stimulation.
I love that. It really captures the essence of healthy aging.
This deep dive has been so eye-opening. It's made me realize that musculoskeletal health is so much more than just, bones and muscles.
Yeah.
It's so intertwined with every aspect of our lives.
It affects how we move, how we work, how we play, how we interact with the world around us.
And while we can't completely eliminate, the risk of injuries,
Yeah.
we can definitely take steps to minimize those risks and really protect our precious musculoskeletal system.
Absolutely. And I hope this deep dive has given you the knowledge and the tools to do just that.
It has.
Remember, knowledge is power when it comes to health.
Well said.
Yeah.
So, as we wrap up this episode, let me leave you with this final thought. We focused a lot on those physical aspects of musculoskeletal injuries, but it's so important to remember that these injuries can also have a huge impact on mental and emotional well-being.
That's such a crucial point. Pain, immobility, the disruption to your daily life, those can really take a toll on anyone, regardless of age or circumstance.
It's true. It's important to acknowledge those challenges and seek support when you need it.
Right.
Whether it's talking to a therapist, joining a support group, or simply connecting with loved ones.
Absolutely.
Remember, you're not alone in this.
Yeah.
There are resources available to help you navigate those challenges and emerge even stronger.
Yeah.
Musculoskeletal health is a precious gift, and it's something we should all cherish and protect.
Absolutely.
And by understanding the risks, taking preventive measures, seeking prompt medical attention when we need it, and embracing that holistic approach to care, we can empower ourselves and our loved ones to live active, healthy, and fulfilling lives.
Couldn't have said it better myself. Thanks for joining us on this deep dive.
Thank you.
I hope you gained some valuable insights and a renewed appreciation for just how incredible the human body is.
And until next time, stay curious, stay informed, and take good care of yourselves.